Do you know what PEMF stands for? Pulse electromagnetic field. This is amazing. It's cutting edge and it can help improve your treatment outcomes and the efficacy of your sessions with patients. I'm thrilled to bring on to the virtual stage Dr. Riz as he explains to you what PEMF is, the benefits and potential uses of this powerful modality. Dr. Riz, take it away.
Hello. I hope everybody can see and hear me. If anybody's having any issues, just go ahead and place in the chat. All right, and thank you, Dr. East, for the introduction and for putting on this wonderful summit here. It's really excellent to see the gathering of the minds and what we can do to help make more of a difference in the world. So thank you very much. My name is Riz Lakhani. I am a licensed acupuncturist, and I also specialize in PEMF therapy. So I'm curious if anybody has ever heard of PEMF therapy. Would you go ahead and put a 1 in the chat? And if you've had an opportunity to actually experience PEMF therapy, put a 2 in the chat. And then lastly, if you've never heard of this before, go ahead and put a 3 in the chat, please. It'll be very interesting to see what kind of responses come up. All right, so 3s and 2s. Okay, very good. Okay, and a couple of folks that have heard of this before. All right, wonderful, wonderful. Okay, well, we will take today to educate everybody about what exactly PEMF therapy is and how it can help people. So let's start off by talking about what exactly does PEMF therapy mean? So as Dr. East said, it stands for pulsed electromagnetic fields. And electromagnetic fields are essentially a phenomena of physics that it's just happening around us. Actually, the previous speaker, Dr. Jazz, even had mentioned that the heart has its own magnetic field, which is true, and all the organs, actually all cells in our body do. So we have trillions of these little magnetic fields happening at any given time, as long as we're alive. Now, that's one of the interesting things about life, is that life is all about movement. And so when the movement stops, that's when life is over. Until that time, you're moving even when you're not moving. So there's all these thousands of things going on inside the body in any given second, all these different reactions in the cells and activities taking place that we are just not even aware of. So talk about subtle energy. This stuff is just happening on its own. Very interesting when you think about that. So coming back to PEMF therapy, we have these electromagnetic fields. They exist in nature, they're a phenomena of physics, and pulsed basically means that they're moving. So it's not like a refrigerator magnet where it's just stuck in one place and it has a constant magnetic field, or magnets that you might use to keep your paper clips together, if anybody still even uses paper clips. So the magnetic fields that we are talking about are moving. They're not static. So we've configured them to move at a certain rate or a certain speed. So PEMF therapy is all about applying these magnetic fields to the body in order to stimulate the body by providing charge and allowing it to quicken its healing work. Now, I don't have any slides today, but let me assure you, there is an abundance of information about this stuff. If people are interested in slides, feel free to email me. So I'll give you my email address now, and I'll repeat it again later. It's Riz, R-I-Z, at drpawluk.com. So that's drpawluk.com. And as mentioned, we have a variety of presentations and slide decks on many, many different topics. And so we can provide that to you. But today, what we'll do is cover a few important items so that people can really understand how to use PEMF therapy, how it can be beneficial to the body, what it does. Many folks have not even heard of this. There were so many 3s in the chat box. And so this is something that I consider to be something everyone should know about, but they just don't know. They're not aware of it yet. So we're part of that increasing awareness, and we're part of that educating the public to help them learn about this novel concept that's been around for a very long time. So it probably makes sense to start off talking about why am I even qualified to talk about this stuff. I have used, well, let me start at the beginning. So as I mentioned, I'm a licensed acupuncturist, and I came to this field mainly because of a calling in my life. And so what I mean by that is I was not somebody who came to acupuncture school because I received acupuncture and had this wonderful experience. Very much like a lot of my classmates, they went and they got treatments like acupuncture and did so well that they wanted to go and learn how to devote their whole life to doing that for others. But that wasn't the story with me. In my case, I was actually working in the private sector many years ago, and I had a lifelong yearning to want to do work with this short time on the planet here, because it is a short time. You know, it's gone in the blink of an eye, isn't it? And I just turned 40 recently, and I remember there was a time in my career where most of my patients were actually much older than me, and now things are changing. It's happened so fast where a lot of the patients are actually younger than me. And so this magical life that we have, that we're lucky enough to experience, and yeah, it definitely goes fast. Unless, like Sadhguru says, if you're a miserable person, then it's going to be a very slow experience. But even for those people, it probably moves pretty fast. So I wanted to use this limited time here to help people. And I kind of stumbled into acupuncture. So the local acupuncture school was a few buildings down from my workplace. And one day I was taking a walk, and now I had seen the signs for Thai Sophia Institute for years, but I had no clue what that was. And one day on my walk, something compelled me to just go inside and see what this place is. And I learned it's an acupuncture school, and you can actually go and get a master's degree in acupuncture, and then you can go and obtain a license. But it wasn't really the acupuncture. It was the notion of being able to help people, to serve them, to use my hands, something that's becoming, less and less common, isn't it? And to have a different way of thinking, how to approach people, and how to be of service to them. And it seemed like acupuncture was going to be the way that I would be able to do that and have legitimacy, have a degree, have a license, and start working with people. So that's what I did. But the reason I think this is important is because I did not go into this work thinking that acupuncture was going to be the thing that fixes everything. Because I think a lot of times in even the different types of acupuncture school, we're sort of taught that you can fix any problem with it. And I think anybody who's been out for a little while realizes that's not truly the case, is it? If somebody doesn't get better, is it because you didn't pick the right point? You didn't put the needle in deep enough. Probably a big contributor is that they may not have come enough for treatment, but that's a whole other topic. People need a lot of treatment these days, especially given all the stuff that we've got going on. So I was enamored by the fact that I could use my mind and my hands to help people, but I realized quickly that it wasn't necessarily going to be the thing that solves everybody's problem. And full disclosure, I still haven't found that thing, if it even exists. It probably doesn't, but who knows, right? And we'll find out. So one time in doing a marketing event for my acupuncture clinic, I attended a wellness fair. And at the wellness fair, somebody walked by the table and asked me if I wanted to have a electromagnetic treatment. And I had never heard of it. So I simply said, actually, I found out this person was a retired nurse. And now I think nurses are the unsung heroes and the workhorses of the medical system. And I have tremendous respect for them. And I always listen to what they have to say. So this woman offered to come to my office on another day and give me an electromagnetic treatment. And when she did, I didn't really feel anything. But there was some literature that she gave me. And in that literature, I realized that this electromagnetic treatment, or actually it was PEMF therapy, although that's not how she introduced it to me, I discovered it's PEMF therapy. And they're trying to do a whole bunch of the same things that we're doing with acupuncture: increasing circulation, reducing inflammation, helping to relax the nervous system, helping energy to flow better through the body. So I thought, hey, this is really cool. I'm finding out about a way that I could do all the stuff I'm trying to do with the acupuncture without necessarily having to stick a needle in. Of course, there are times where the needles are definitely important, and I have certain cases where I will rely on the needles. However, that's not my only tool anymore. So now, even though I didn't feel anything from that first treatment, it was interesting enough to look into more. And so that began a journey of starting to research, of spending time every day, hours, poring over, learning, what is this PEMF therapy? Why have I never heard of this? Now, a little bit later, I'm actually going to change rooms here, and I'll show you some of the equipment that we work with. I'll also show you some books that everybody who's interested in this topic should know about, because there is a plethora of research and science that's been around for decades. One of the things I discovered in that early research is that this PEMF therapy has a very high safety profile. And that's one of the really nice things about acupuncture too, isn't it? But we still run the risk of bruises and injuring tissues, puncturing tissues that shouldn't be punctured. I think everybody who does acupuncture is familiar with it, probably knows what I'm talking about. So you can cause damage. Although, of course, the safety profile, again, of acupuncture is very high, but I'm attracted to ways that we can help people and keep it safe and keep it effective. And so that really attracted me to this, because the way you do PEMF therapy, and I'll show you this shortly, is by applying pads or coils to the body. So just going back a little bit more into what is an electromagnetic field. Anytime that you're running electricity through a copper coil, you're going to generate an electromagnetic field. And then you can use technology to configure that field to have a certain force or intensity to it, and also a certain rate or how fast it's traveling. Now, one of the reasons that the PEMF therapy is so safe is because it's not something that actually stays in the body. Now, when we put an acupuncture needle in the body, that is there for the amount of time the needle is retained. Similarly, if we are using laser or light on the body, that's typically thought of as being absorbed, and the body absorbs that photonic energy and then turns it into ATP or other things to help heal. Food, medicines, they are all things that are going into the body, and then we metabolize and break them down and use those nutrients. Well, it's different with PEMF therapy because it's a phenomenon that goes right through our body like we're not even there. So in other words, these magnetic fields have long wavelengths, and they don't get stuck in our body. They just go right through. One of my mentors, Dr. Pollock, who's the foremost expert on PEMF therapy, he often talks about it as it's like the wind going through the trees. And the only way that we know it's there is because there's movement in the leaves and the branches. Otherwise, we don't see the wind. And similarly, we don't see these PEMF therapy. But these fields and waves travel right through our body, and inside of these fields is charge. And that's what I really think has a lot to do with this concept of chi that's been fought over for so many decades and centuries. It's the movement. So as long as we have those motive forces in our body, we can stimulate them with PEMF therapy. So I mentioned Dr. Pollock, and Dr. Pollock is important to know about because he is the foremost expert in PEMF therapy, and I was very fortunate to work with him. So I discovered in my research with PEMF therapy that Dr. Pollock, who has written all the books that I'm going to show you later, he actually happened to be in the same state that I lived in, which is Maryland. And so I made it a mission to go and seek him out and learn how I could absorb all this knowledge from him, because he is somebody who was a medical doctor for 50 years, and he still retains his license, although he doesn't practice privately anymore. And he has been the expert in magnetic fields for 30 years. So that's a pretty extensive career. And this guy happened to be right near where I was located. So I had to go and seek him out. And I spent a lot of time with him. And along the way, I actually became a part of his medical staff. So in addition to my private practice, I work with drpollock.com to help educate people about PEMF therapy. Because oftentimes what happens is people become introduced to the PEMF therapy through a certain manufacturer or through a certain equipment maker. And that's exactly what had happened with me at that wellness fair. There was somebody who was coming by with a specific piece of PEMF equipment, and that was being touted as the best. But there really is, there no best. It's kind of like saying the best acupuncture. What's the best acupuncture? Probably what the patient needs at the time. So similarly, Dr. Pollock has a philosophy that there is no best PEMF therapy device. Rather, we have to figure out what the person who's going to receive the treatment needs, what their goals are, what they want to accomplish, where they are currently in their state of health. And then we can make a recommendation based on all those things, because there is no one size fits all, just like with acupuncture, right? So this is all about figuring out how do we take the person's needs and make the best recommendation for what kind of PEMF therapy will be best for them. Okay, so another interesting thing that comes up with PEMF therapy is, doesn't those four letters PEMF, doesn't that contain the letters EMF in it? And aren't EMFs pretty harmful and bad for us? Yeah, the answer is yes. You know, being exposed to Wi-Fi routers and being exposed to cell phone towers and these types of things are harmful stimuli. Now, remember, I told you PEMFs have a very long wavelength. They have exactly a very long wavelength. Well, these other devices like the Wi-Fi signals and the cell phone radiation coming out of our devices, they have short wavelengths. Those can get trapped in the body and they can get stuck in the body. And that's why they actually can cause a lot of problems. So PEMF therapy is therapeutic, and it uses very low frequency. Now, frequency is a term we have to be careful about, because this is sort of the common vernacular that's used, but PEMFs actually don't have a frequency. They have a pulse rate. So that's different. Now, frequency is typically associated with electric current, electric stimulation, and that type of thing. But it's the same concept. It's how many pulses per second, or how many cycles per second. So magnetic fields have a pulse rate, and the high frequency types of stimulation like Wi-Fi and like cell phones and these types of things have a very short wavelength, and they can actually cause heat in the body. Towards the end of the presentation here, I'll tell a story about how I actually experienced this myself. And I only learned about it because of PEMF therapy. Okay, so with these magnetic fields that we use, and sometimes we call PEMF therapy, just shorten it to saying magnetic field therapy, they often have a pulse rate and they'll have a level of intensity. And there's many devices out there in the marketplace that are low intensity as opposed to high intensity. So this is something that we need to know about. When it comes to PEMF therapy, there's low intensity devices. That would be more like what we might call subtle energy. Then there are high intensity devices, which are actually not quite so subtle. We'll do a demonstration and show how this actually can elicit movements in the body. But those high intensity magnetic fields, although they're not so subtle, the benefit that they provide is that they can actually do deeper work in the body. With higher intensity PEMF stimulation, you are able to deliver stronger magnetic fields to a deeper depth in the body. So if somebody has a problem in one of their organs, a liver or an intestine, you can actually use the PEMF therapy to treat those areas through the clothing, right through the skin. And if you have the right level of intensity, you will deliver charge to the physical liver or the physical intestine or whatever area it is that you're trying to treat. So our acupuncture channels are named after organs much of the time, but that doesn't necessarily mean that you're physically treating that organ, right? Many people have no longer have a spleen or a gallbladder, but they still have those acupuncture channels, they still have those functions. But what if we actually need to physically treat the spleen if it's inflamed, or we need to treat an inflamed digestive tract? We could do plenty of acupuncture and we could do herbal medicine to help with that. But you can also use PEMF therapy because it travels right through the body, like we talked about before. So, in doing so, if one has the right amount of intensity, which there is a number for that, then that intensity will deliver enough charge to the physical organ. And really, it's not just the tissues, it's the cells that are benefiting from having that charge so that they can become more robust. Now, there's a lot of different biological actions that are happening when you do PEMF therapy. One of those is that you're improving and increasing blood circulation. So I think that's one of the most important concepts we have just in wanting to help people with disease and with illness. Um, we want to generally be able to improve blood circulation. And when you expose the body to PEMF therapy, any type of PEMF therapy, it will do that. If it's a higher intensity, then it will have that function deeper in the body. But this is something that is extremely beneficial, and you can accomplish this alongside using something like needles or using other modalities. There's probably practitioners of other styles, of other techniques on this summit, and just about all of you can use PEMF therapy alongside what you do to actually help the internal condition of the body and improve what it is that you're doing with these patients. So um, now, the number that I had mentioned as far as being important for intensity is 15 Gauss. So the research has shown us that if you can deliver 15 Gauss of magnetic field intensity to a target tissue, then you can actually start to reduce inflammation via the increase of production of ATP in those cells. So that's a key number because there's a lot of devices out there that don't even come close to delivering 15 Gauss. And even if a device does have a maximum output of 15 Gauss, that intensity diminishes very, very quickly as soon as you come out of the applicator pad. And I'll show some of this equipment a little later so you can see what it looks like. But in other words, if you start with 15 Gauss, within just a little tiny bit of distance, that 15 has gone down to very close to zero. So remember, you need to get 15 Gauss to reduce inflammation at the target tissue, whatever that may be. It could be the heart, it could be the kidneys, it could be the bladder. Something that we work on very often with people at our clinic here. Okay, so one last important thing about the basic science of magnetic fields is that nothing uses it up. So even as it's traveling through your body, it's not like you actually use up the charge in the field. It is just there and it passes through you, and our tissues benefit from this, but nothing blocks it, nothing stops it, with the exception of metal. Now, if you have metal in front of a magnetic field, the magnetic field will go around it. Many people have pieces of metal in their body. Can they use magnetic field therapy? Yes, absolutely they can. It is safe. The magnetic field therapy is not used when there are electronic devices, with some caveat here. So we used to think of things like pacemakers, spinal stimulators, cochlear implants, and these kinds of electronic devices as contraindications for PEMF therapy. And nowadays, there's actually devices that are compatible. So, for instance, if somebody receives a pacemaker and their doctor has told them that they can go and get an MRI, then they will be able to use PEMF therapy because MRIs use high intensity magnetic fields. So nowadays, we still have to be careful, but there are folks who can benefit from PEMF therapy now who we never would have had them try it in the past. In my own clinic, I'm thinking of a woman who had a pacemaker, but was having a lot of leg pain. And we were able to successfully use PEMF therapy to help her knee and leg a lot. And we did the PEMF therapy away from the chest and the heart where the pacemaker was. And she never had any problems. She benefited tremendously. She was an older patient, didn't really want a lot of needles. And so we were able to meet her and give her something that would really help with her problem. So we have to be careful about things like electronic implants, pacemakers, spinal stimulators. We also don't do PEMF therapy if one is pregnant. This is not because it's been shown to be unsafe, but we just don't have enough science and research to really show us that it is safe. And so we err on the side of caution. Now, I actually think I've helped several patients become pregnant with the use of PEMF therapy in their treatments. Now, it makes sense because when you're treating the body with PEMFs, you're getting a big improvement in blood flow. And what are we trying to do with fertility treatments? We're trying to get a big improvement in blood flow to a certain area of the body, or better yet, all of the body, but with emphasis on the reproductive system. And we can do that with PEMF therapy. So I actually think that we've been able to help women become pregnant by using PEMF therapy. Then, of course, we had to stop once they became pregnant. There are reports, anecdotal reports of women that have done PEMF therapy throughout their pregnancy with no adverse effects. So we have a pretty good sense that this is probably safe, but we still don't do it. There's one other big contraindication, which is organ transplants. So if a patient has received an organ transplant, we just don't do PEMF therapy on them because they're on immunosuppressants. And we don't necessarily want to improve the immune system to the extent that it would reject the organ. Now, we know that we can do acupuncture safely on these patients and we can bring them relief in that sense. But we would not do magnetic field therapy because we just don't want to take that risk. So that's the biggest contraindication that's out there, followed by electronic implants. We have to be careful and ask, are they MR compatible? Did the doctor tell them they can go get an MRI? And then, of course, with pregnancy, we exercise a lot of caution. And that's pretty much it as far as contraindications go. I will, in a little bit here, tell some interesting stories about things that we've seen happen with PEMF therapy. And they're things that oftentimes I don't think I would have really been able to affect with acupuncture alone. All right, so we'll give you a couple of reasons of why one should consider using PEMF therapy, because it is using technology. Now, that's one of the beautiful things about this. In our current state, this current day and age, we have become masterful at creating all this technology that was supposed to be really helpful to us, and it is, but it's also become a hindrance in many ways. So, just think of email. When email was invented, it was supposed to be a way to really quicken communication. But now we're responding to emails within minutes because our inboxes are piling up and we can't stand having these unread messages. And we know people are relying on us to get back to them quickly. So this thing that was supposed to help us almost became something that created new problems for us. Don't even get me started on cell phones and screens and all that stuff. I mean, yeah, we got to use them. We do, unless you can be really vigilant and figure out a way not to. But with PEMF therapy, we have been able to leverage technology that really only does good for people, for the body, for us. And that's another reason why I really, really love it. So now, yes, it's technology. It's a way to modernize our practice. It's a way to have solutions. If you're not a practitioner, you can certainly use this for yourself. Or that's actually one big reason to have it is if you are a practitioner, you could use it with patients, but you can use it on yourself. Do people ever ask you, hey, do you do acupuncture on yourself? Or, do you receive acupuncture? And most of us would say yes, but there's some areas I can't really, get to if I want to put needles in. but I can get to those with PEMF therapy. So not only is it a tool that's helpful for people that you see or treat or work with, family, pets, because PEMF therapy works on all biology, including plants. So you can use this for yourself in addition to using it for others. One of the big benefits that we often discuss is that when somebody has a PEMF system, it actually belongs to their entire household, because it's not like it's just limited to that one person using it. Everybody can use this stuff, and they should. People should have PEMF therapy in their first aid closets, but they just don't really know about that. And hopefully by the end of this talk, you'll understand more about why I make this recommendation. Um, so what about with acupuncture? We have one of the gifts of acupuncture is that it can be so precise. It is going to a particular place, and we're treating that exact spot. And yes, oftentimes we are experiencing benefits in other areas of the body, but it's precision. You got to treat that point. And we kind of mentioned this earlier. Like, what if the patient doesn't get better? Did you not treat the point right? Was it not at the right depth? Was it not the right type of needle? Did they fidget during the treatment and move the needle? There's all these considerations. And so as healers, as doctors, we have to think about what is it that our treatments might be missing. So might I be missing things with acupuncture if I'm being so precise and I'm, going to a very particular placement on the body? But what if the person had something going on elsewhere and I didn't needle that point or that channel? Well, the PEMF therapy covers all my bases. And so as a practitioner, it's a way to stack the deck in your favor. Routinely, I don't know if I mentioned how long I've been doing PEMF therapy, but I've been researching it for the past 7 years. I've been using it in my clinic for the last 5 years. So I studied it pretty heavily for 2 years before I ever invested into equipment, because depending on what device you have, it could possibly become expensive. There's a lot of value. But in my clinic, just about every patient is going to get PEMF therapy and acupuncture. Because why would I withhold something from them that I know is going to help them? And it's generally not going to overwhelm the system. We do have to be careful when we start with PEMF therapy, because we want to test and make sure we don't overwhelm very sensitive people. Those are the ones that generally have more risk. People that are healthy or dealing with more so musculoskeletal problems, or younger folks, don't have a lot of chronic disease or sensitivities, they will be able to tolerate more magnetic field stimulation than somebody who's really sensitive and really toxic or overloaded with a lot of stuff. So just about everybody in my clinic will get PEMF therapy along with acupuncture. And that's how we cover our bases, and we make sure that we are addressing the things that we may not always actively be thinking about. Now, I really love the idea of people coming for acupuncture, not just to solve a problem or other modalities, right? Because other folks do other things. I love the idea of people coming in to see you for treatment, not just because they have a problem, but because they feel well and they want to stay that way. And you can use PEMF therapy for this. You can use acupuncture for this. When patients are coming in for maintenance and they don't have an active problem, we generally want to do a treatment on them that's going to help them remain that way. And so PEMF therapy is a way that I can deliver stimulation to an area of the body or to the entire body, and then let the body do what it will with that charge that's delivered. Because one of the things that we see is that healthy cells ignore the magnetic field. It's just like it's not even there. And the unhealthy cells are the ones that will actually make use of the charge in these fields. So we have trillions and trillions of cells. There's no agreed upon number. Sometimes you hear it's 70 trillion cells. All those cells are doing thousands of biochemical processes per second. And every single one of those interchanges, those exchanges of communication, is electromagnetic in nature. It's the physics of the body. This is probably one of the big misgivings of the current medical system, is that we focus so much on the chemistry of the body. But what's driving the chemistry of the body is the physics. And so doing PEMF stimulation is helping at that physics level of the body, providing the body with the charge that it needs. And then when we're doing acupuncture, we're able to stimulate channels, we're able to relax the vagus nerve, we're able to um, remove trigger points in muscles, or we're able to restore range of motion or function. Now, those are things that I often will use the needles for, that in combination with the PEMF therapy. So coming back to why should we use this stuff, high safety profile. It can treat what the acupuncture misses. You know, we have to be humble here. We don't know everything. We just don't. And so claiming to know everything, or being able to fix every single problem, that's not realistic. But when we're able to work at the physics level of the body, we can give it more of what it needs. And so I can be precise, but I can also be broad. And so that's one of the gifts of PEMF therapy. It helps our cells. So, we are not just a body, mind, and spirit. If you look at the body, it's a collection of tissues and a collection of cells, whether that's bones, nerves, organs, the brain, fat. All of these things are made out of cells. And PEMF therapy directly affects all of the cells of the body. In fact, one of the first uses of it in the Western world was to help non-union fractures. And that's because it's helping the improvement and the healing process of bone cells, both osteoblasts and osteoclast activity. But you have to have a right amount of intensity to be able to stimulate the bones. And if you don't, now often we find in the Western world, they're using weak magnetic devices, and that's why you have to have it on for 10 hours a day or more than that. So that can be pretty lengthy. You can use higher intensity PEMF therapy to quicken the healing and make it a faster process. They're really, we could spend a very long amount of time on this. Dr. Pollack has come up with several courses that are available on our training website, and I'll share those with you, where we can go into hours and hours of the science. But just to condense it, I'll also mention that PEMF therapies improve stem cell production. And so by applying PEMF stimulation to the body, we can make more stem cells. And this is actually a lot of the research that has come out of NASA. NASA years ago took on a pretty heavy role in researching PEMF therapy, and they came out with a lot of really great findings. And so that was one of them, is that we can increase stem cell production and really help with the regeneration of all cells, nerves, skin, so many different things going on. All right, so now will be a good time to show you some equipment. I'm going to change rooms here. Bear with me for a moment as I roll my computer down the hall here. All right. So what we have here is a high intensity PEMF device. And this device is called the PARMEDS Multi-Flash. So the way that we use this device is we take our pads. So this is one of the pads, and we have other ones as well. And you simply place them onto the body. So when I place the pad here, I'm treating my upper chest, along with my heart, my lungs, thymus gland, everything else that's in there, the bones of the rib, the little muscles between those bones. Aren't people having a lot of problems with things like long haul COVID, fatigue, not being able to breathe properly? Yeah, so these are ways that you can help these patients in a deeper way. Now, there also is something called the loop coil. So the loop coil is something that can just sit around my neck, like so. And when I connect this and I'm treating myself, I'm treating the brachial plexus, I'm treating the cervical spine, I'm treating the pectoral muscles, and again, the heart and the lungs and the thymus, because this goes right through all of my tissue. And so this is a way that I can deliver treatment to those areas, but I can also bend this a bit. And when I do that, okay, I can treat my head and brain. Okay, I can wrap it around a shoulder. I can wrap it around a knee. And so that's a way that we can specifically deliver the magnetic field to particular areas of the body. These days, a very important topic that's been coming up is pelvic floor patients. And so you can actually take this loop coil and you can get it on the pelvic floor. And now I'm treating the pelvic floor muscles. I'm actually getting blood flow into these muscles that haven't been working well and causing a lot of pain and distress for people. In addition to the other stuff we're going to do, like the pelvic floor PT, like the acupuncture, like the meditation, and all of the other things that people need to help see this problem through. But I can do something different with the PEMF therapy that's not available to me with other methods. Let me show you what it looks like to do this on myself. All right. So I have turned my machine on here. And it's very easy to use here. So it's just got 4 buttons. And I'm going to go ahead and turn it up to the highest intensity. All right. So that's a 9 for program number 9. Okay. And let's set this up so you guys can see me here. Okay, so I want you to watch my hands and my fingers. So you may be hearing a little bit of a tap, and you almost see me waving at you. And this is involuntary movement. This is because the magnetic field intensity coming out of this pad is strong enough to elicit muscle contraction. And in a moment, I'll show you a little bit more of a dramatic example of this. But here you go, where we have the pad sitting on my right chest and shoulder, okay, right where I'm holding it here. And it's causing my entire arm to move. Okay, now this is really cool because don't we sometimes see this? Now people make comparisons like, what about TENS? What about electrical current? What about electroacupuncture? Yes, we see these kinds of things happen with those, but in the case of TENS, you have to stick a little patch on your body, and then you have to bypass the resistance of the skin. Same thing with a needle when you're doing electroacupuncture. You got to get that needle into where it's going and then clip your stimulation onto it or touch the needle with the stimulation. Well, with this, it's affecting all of my tissues and it's causing enough torque forces here to actually move my entire limb. Now, this device, the multi-flash, it generates up to 4,000 magnetic, 4,000 Gauss magnetic field intensity. I have stronger devices, and if I turn those up all the way, you will see much more vigorous movement. Okay, so let me show you what it looks like with the loop coil. So this is our 7-inch square pad. And this device I'm showing to you right now, I mentioned to you, is high intensity. That means that it's often going to be found possibly in a clinical setting. But these are devices that people can and should know about and use for themselves too. All right, I'm going to connect my loop coil here. And let's get this around my neck. So if I start this up here. Okay, so watch my fingers again. You can kind of see a little bit of movement. It may not be a great visual here, but I can definitely feel it. There you go, that might be a little better. So this is with my elbows resting on my legs. But the stimulation, the therapy is taking place on my neck and on my chest with the loop coil. Why is all this happening? because of stimulation of the brachial plexus. And those nerves are then innervating the muscles here, which are all rocking with this magnetic field. All right. So we'll pause this for a moment. Now, PEMF therapy devices don't just have to be big. They can be small, they can be portable, and I'll show you an example of what that looks like. Oh, you know what? Before I do that, I think there's one more visual that'll be really helpful. So check this out. So I'm going to reconnect my little square pad. And then we're going to use a test magnet on it, and you're going to actually see the magnet move. All right. So here's our square pad. Here's our test magnet. Okay. And when I start this up in a second here, you might notice that there's some movement going on. All right. You guys see that? So if we bring it to the perimeter here, there's a more dramatic movement. Okay. So all that is to show you that that there's a lot of power coming out of these things here. All right, so we also have portable PEMF devices. And this is an example of one of them. So this is called the Flex Pulse device. And this is taking a magnetic field and delivering it to a smaller area. So anywhere in the body is safe to treat, as long as we don't have those electronic implants that we talked about, or the patient doesn't have an organ transplant. And so that includes the brain. So you can actually use this device to deliver PEMF therapy directly to the brain. Magnetic fields will travel right through your bones and your skull, and they can actually affect the tissue of the brain. They can affect inflammation in the brain. This is something that we really need to know more about. And we're seeing that there's a lot of clinics that are offering things like transcranial magnetic stimulation. And so with that, they're using high intensity magnetic fields on the head to treat depression. So you can actually use this stuff to help with depression as well. Depression is going to cause inflammation. It's going to cause lack of energy. It's going to cause fatigue. It's going to cause imbalances. And so we can use this technology to stack the deck in our favor and give us a better fighting chance in a safe way that's effective, that's therapeutic, and that is not going to deliver any damage to the body. So if I turn my Flex Pulse on here, now this is cool because it has a bunch of programs. So the previous device that I showed you is the ParMeds Multi-Flash. And what that does is it delivers a particular intensity. And depending on which program you're using, you're going to have a corresponding intensity. With this device, we actually use the pulse rate along with the intensity, especially when we're using this on the brain. So in other words, for people that are familiar with PEMF therapy, for many years, a big fuss has been made about what frequencies are you using? You know, what frequency do you use for that? I think that's much, much more relevant for discussions about microcurrent, right? Frequency specific microcurrent, or electroacupuncture, where we want to deliver a specific electric frequency to the body. Well, we found out increasingly that with PEMF therapy, the frequency is not really as important, or pardon me, the pulse rate is not as important. With PEMF therapy, the most important critical factor is the intensity. But that doesn't mean there's no value in having different pulse rates. So this device, the Flex Pulse, it has 10 different programs on it, and you can actually use it to entrain the brain. So what I mean by that is if somebody has difficulty sleeping and their brain doesn't necessarily want to go into delta, you can use a delta pulse rate with this and put it on the brain. So in this case, it's 3 pulses per second.
and the brain will actually start to oscillate at 3 pulses per second. And somebody who usually has a lot of difficulty going to sleep or feeling tired will be able to sleep better. On the flip side of that coin, if somebody has difficulty focusing and say they've got a big project coming up, but you can't really gather that attention, you can actually use the pulse rates in this device to help the brain oscillate at a state that's going to help it be more productive, have more alertness, all right? Beta, okay? You can also use it for getting the brain into alpha. So the portable PEMF device, it's smaller. However, we can use it for brainwave entrainment. And of course, when the brain is functioning better and it's in a better state, then of course, everything else is also going to generally fall in line, or at least have a better chance at that. Plus, we all have so much stress. I grew up, reading about how stress was the invisible killer, and that hasn't really changed at all. That's if anything, we have more and new sources of stress now than we ever had before. All right, let's do a quick time check here. Okay, so I've got a few more minutes left. So let's start to wrap up here. I just want to show you guys a couple books that you should know about. Okay, so Supercharge Your Health with PEMF Therapy is a recent book published by Dr. Pollock. It's a very practical book. So if people want to learn how do you use this stuff, what are more of the details about how can I actually use this on myself, this is a great book to have. You can get this on Amazon. There also is another book that Dr. Pollock wrote, and that's the Power Tools for Health book. Okay, and that looks like this. Now, this book here is all about the science. So if you're somebody who's really science-minded and you want to know the research, there's over 500 study references in here. So this may not be so suitable for somebody who just wants to get the practical, relevant information, but for somebody who wants to dive deep, this is a great resource. And a website that everybody should write down is drpollock.com. So that's drpawluk.com. This website is the most extensive website on the internet about PEMF therapy. And it contains blog posts, it contains research, it contains articles. We keep it up to date. And just about anybody that you see talking about PEMF therapy is using that website as a reference. It's free, it's out there, it's available. So a lot of the information that's in the books is also there on the website, chunked out. I encourage people to look at that. And our company, drpollock.com, offers the ability for people to schedule phone consultations with us. A lot of times when we talk to people, they have had a big problem. They've discovered PEMF therapy as a possible solution, and but they don't know which machine is going to be best for them because there's a lot of confusion. And if you go to a particular company that makes a machine, they're often going to veer you towards their machine because everybody thinks what they make is the best. And that's actually not true. There's a lot of myths out there. Some folks have very, very low intensity devices and claim that theirs are the only ones that improve circulation. That actually happens with all types of PEMFs. So there's a lot of considerations here. You can do full body PEMF therapy. So I have a table here that patients can lay on, or I have a chair that they can sit in. Because we may not be interested just in working on one part of the body. You may be wanting to affect the whole body. That actually is my preferred approach because, again, we catch the things that we may have missed. So in a nutshell, the PEMF therapy is a really wonderful thing to do by itself. It's also amazing to do and combine with other modalities. I hope that this presentation was helpful and beneficial. And I'm just going to take a look and see if we have any questions here at all. And if anybody has questions they haven't posted yet, I think we have a few minutes to complete them. Okay, so somebody's asking, is this similar to the HiDAO XPD? I actually am not sure what that is, but there's a comment about it being for muscle stimulation.
for pain and muscle performance. So yeah, PEMF therapy will get the body moving. It'll get the muscles moving when you have high intensity, but it's going to stimulate everything else as well. So muscles attached to bones. PEMF therapy will help the bones. Muscles have nerves that come and innervate them. They're also covered with connective tissue. PEMF therapy helps all the cells of all those individual tissue types. Let's see. Somebody's asking, what does it feel like? Does it feel like a TENS unit? That's a great question. The answer is it's very individualized. If you are using a low intensity PEMF device, you probably won't feel anything. If you are using a high intensity PEMF device, then you might feel strong stimulation. Let me just give you one last example of what this looks like on myself. It's not exactly painful. It actually can feel very unique and interesting. But if you turn it up high enough, if you have a device that is very high intensity, then yes, it can be uncomfortable. And so as a rule of thumb, we just don't simply treat at levels that high. We let the body develop a tolerance. I'm sitting in my PEMF chair. I'm going to turn this up. You can hear the clicking noises. Watch my abdomen. Actually, I don't know how great of a visual this is, but we can see that there's a lot of, look at my legs here. Yeah, look at my foot. So my foot is not even on the pad. Okay, so it's responding in that way because of the strong stimulation from above. So what does it feel like? You almost kind of have to experience it for yourself. I wish there was a better, more clear answer. Okay, now somebody's asking, stomach problems can cause sleep or mental problems. Oh, you know what? Yes. Thank you for bringing that up. I didn't share my cool stories with you. PEMF therapy generally is going to help people sleep very deeply. That's something I've experienced myself. I've had a lot of patients also experience that. And it's almost a bit of a joke, you know, getting the PEMF sleep. Let me quickly tell you some other cool stories. So I had a gentleman with atrial fibrillation. He came in and he said, hey, I read online that acupuncture can help with that. And I didn't really know how I was going to use acupuncture to change the rhythm of the heart. You know, I didn't know. But this was around the time I got started with PEMF therapy. So I told him, why don't we do PEMF therapy and see how that helps? So this gentleman actually would happen to be an electrician. So he had a little bit of an interest. And we did it. And he had an Apple smartwatch. He took his EKG before doing the treatment. He was in AFib. He then did it again after the treatment. He was still in AFib. Then about 15, 20 minutes later, after he got home, I got a phone call and he tells me, hey, I'm out of AFib. I'm into normal sinus rhythm. That was cool. I did not want to give it too much meaning because was it the PEMF therapy? Was it something else? I don't know. But what happened was that happened again. He came back to the clinic again. He was in AFib, did the treatment, goes home, no longer in AFib. Okay, that's pretty cool. And that happened several times. I think it's safe to say that something's going on there. We've had reports of customers of drpollack.com who have increased their bone mineral density, their bone density, right? You get a DEXA scan, you're osteopenic or osteoporotic, you can actually regain bone mass. So a woman was using this daily for 11 months and all her scores went up. I don't have them handy in front of me, but it was significant. People with stage 4 cancers, PEMF therapy should be used extensively in cancer. The question comes up, well, aren't we feeding the cancer cells? Maybe, but you're feeding all of the other cells that help create a better environment, less oxidative stress in the body. We've had people that have been told that they, were going to pass soon and they were able to live long lives. One woman had breast cancer. I was sitting in a consult with Dr. Pollack. A year prior to that, she had mets to her bones, her liver. A year later, she's doing a follow-up consult. All those mets are gone. It's amazing. Sleep, we talked about. We can reduce frequent urination. I had a gentleman who he was waking up every 40 minutes. He couldn't even sleep for more than an hour. And we got him down. So he was waking up 10 or 12 times a night. We got him down to waking up 1 or 2 times a night. Amazing, by treating the bladder and the prostate. Okay, last story here.
I showed you the full body table. When I used to lay on the table, I would never feel anything in my lower body. After a few months, I started to. And I realized what happened was I was getting this sensation in my leg right here. Okay. I didn't know what was happening. And then after it happened 2 or 3 times, I realized, wait a second, that's where I keep my cell phone in my right pocket all day long. I know that thing is messing with me. You know, that cell phone is not putting out helpful signals. So it was honing in on the inflammation in my leg from having my cell phone there that I didn't even know was a problem. Okay. I have more stories. I want to be mindful of the time here, so we'll go ahead and conclude. I know there may be other questions, so please go ahead and send me an email at riz@drpawluk.com, riz@drpawluk.com. You can apply for a phone consultation with Dr. Pawluk or myself or one of the other members of our team. We provide this service as a complimentary service for people to inform and educate. So we hope that that's helpful. Maybe we'll talk on the phone soon. And until then, best of luck. Thanks, Dr. Riz, for hosting this. And everyone stay well.